Statistics indicate that between 1 and 45% of the population in any given country might have irritable bowel syndrome, a condition that affects the large intestines.
It's a functional disorder that happens to the gut, to the whole system that deals with the food, the digestion and the transportation of food up to when it reaches the rectum when we eliminate it.
A patient may present with one or all of the following symptoms of irritable bowel syndrome: abdominal pain or cramping, a bloated feeling, gas, diarrhea or constipation, mucus in the stool, among others.
Yes, there's an abdominal pain, there's the fullness, and then very commonly when you defecate or pass wind, okay, then that pain goes off.
Dr. Arthur Sesanga, a family physician at International Hospital Kampala, explains the factors that could spark off this irritation of the bowels.
These are smooth muscles. They're small muscles, not like the way you have other muscles, but these are tiny at a tinier level. So they get into a hyperactivity. So food is supposed to go through there slowly. So sometimes it will go so fast, sometimes it will sort of be repulsed. The hyperactivity might either cause an extreme movement of the food, and then you end up with diarrhea, or it might block a certain part, because once that irritation occurs, then it might not allow food to pass through, and someone ends up with constipation.
But this does not mean that irritable bowel syndrome is the only cause of constipation, a common and discomforting condition.
However, and interestingly, in people with irritable bowel syndrome, even when they eat an apparently normal diet, which is high in fiber, like an oatmeal or vegetables or any other food that has, they might still get an irritation.
The actual cause of this chronic condition is not known, but according to health specialists, certain foods, stress, hormones, some medications and certain illnesses can trigger off the symptoms.
Actually, in most instances, when we have an ongoing irritable bowel syndrome that doesn't seem to go away, then we've got to find out how the individual is faring in their other life, because if there are stressors like work or social life, marriage life and all the like, those can lead to an irritable bowel. Part of it is because the brain, okay, has nerve connection to the abdomen.
And some foods tend to worsen the condition in certain people.
So if you notice that wherever I eat this food, that's when I get the pain, that's when I get the fullness, and when I pass gas, wind, or I get stool relief, then you know that food needs to be avoided.
People below the age of 45, those between 20 and 30, and those with a family history of the condition are prone. Others are those with a mental problem and women. Dr. Sesanga says irritable bowel syndrome does not cause much harm to the body other than the discomfort in the abdomen, but he warns that one should worry at symptoms that may indicate a more serious condition.
Losing weight drastically, or if they developed a fever, or if now they are getting blood when they are passing stool, then we need to look at other possible causes.
Irritable bowel syndrome is a chronic condition that can be managed long-term. Dr. Sesanga says the management of the condition focuses on relieving symptoms.
The final method of management is the psychological management, and that involves managing stress well. For majority of people, if you can manage stress well, if you can handle stressful events well, that's the other way for people who have irritable bowel syndrome, that you manage to handle that.
If not well managed, research indicates that this condition could expose one to cancer of the bowels.
We've got to exclude other abdominal diseases. As we talked about, there are conditions like inflammatory diseases of the bowels that we need to exclude, or things like cancers of the bowels. Those need to be excluded. But after we've made all that all that exclusion and sure this is an irritable bowel syndrome, then it shouldn't be a condition that should worry anyone.
A number of home remedies, however, could help relieve the irritation. These including fiber in your diet, avoiding foods that worsen the irritation, eat at regular times, be careful with dairy products, drink plenty of liquids, and use antidiarrheal medications and laxatives with caution. Gertrude Tumusime Uitkwade, NTV.